Dr. Miller, let's talk about non-invasive facelifts. What
Sure.
is a non-invasive facelift?
So a non-invasive facelift, and I've seen a variety of names popping up all over the place, this lift, that lift, the other lift. I think that to be honest and open and candid with people is so important. And what these are is refined techniques of fillers. That's what they are. So, because when people come to me and say, I want the, X, Y, or Z lift, and they sort of think it's some incredibly unique scientific breakthrough, what I try to be honest with them and say, look, this is just a technique. It's operator dependent. It's a technique and an aesthetic way of doing filler. So it's so important to understand that. Now, does that mean it has no role? Of course it has a role. It could be huge. You can't use a liquid facelift, for lack of a better term, to replace, in the case of somebody who needs a surgical facelift, okay? It's not gonna, if you have so much skin that you have loose skin, you can't just plump it out so much, okay?
Right.
But for somebody who's not quite ready or on the bubble, you can certainly stave off that facelift or bide some time or get them ready for an event they have coming up in a few weeks that they really don't have time to have the recovery of a facelift, even though that can be within 4 weeks for a gala or a wedding or whatnot. But you can get them to that event and accomplish that. So I think it's so important. This morning I had a patient, and she came to me and she says, is it too late for filler? And the thing is, she was in her mid-40s and she had a little bit of skin laxity and a little bit of atrophy of aging, but no, it was perfect answer. We put a little filler in her cheekbones here. We used Voluma. We used a little Juvederm Ultra in the corners of the mouth to turn them up where they were down, highlight the lip line a little bit. It was perfect. Just moderation, spread out, not a lot in one place, but a little in a lot of places. And it gave her exactly what she needs. She said, that's great. I thought I needed a lift. On the other hand, the same day, I had a lady come in who was in her early 70s, and she's like, can I just get the filler? And, I don't know yet. We're doing a medical workup to see if she's a good surgical candidate, but what I could tell you is the filler would leave her wanting. And there's a lot of places she'd go on that would be, yes, hun, let's just pull out a couple syringes and ring up the bill. That's the mistake for her. What we need to do is we need to be honest with her and say, you know what, filler's gonna get you maybe 10% of the way. Is that okay with you? If you're okay with that, then that's great. But if we push that modality too far, if we try to create a facelift with filler in her case, we're going to end up with something that she's not happy with and I'm not proud of.
Right.